have our next student speaker today. Maraia will talk a bit about her PhD in organic chemistry. So, sharing. Right, all yours.
Okay, great. Okay, hi everyone. So my name's Maraia and I'm a fourth year PhD student with the Spring Group in the Department of Chemistry. And today I'm going to talk to you about one of my PhD projects, which is on developing an indole lead compound against Mycobacteria. I understand that we're in quite an interdisciplinary audience, so I thought I'd start this presentation just going into medicinal chemistry and also how it has been used to develop antimicrobials. So first of all, you can define medicinal chemistry as the creation and refinement of a molecule for the purpose of creating or improving a drug. This is on the basis that the chemical structure of a drug, so the chemical groups of the drug, the size of the drug, and the way in which those groups are orientated have an impact on how it interacts with biology. So things such as, does it fit into an active site? What does it do at that active site? Can it even get there? Is it fatty enough to cross membranes? And does it stay there? Is it just broken down by enzymes? And those impact the pharmacokinetics and the pharmacodynamics of drugs. So essentially, medicinal chemistry is looking at how changing the structure of a drug can therefore change the biological activity and improve it, which is the basis of my project. So I thought I would illustrate this with a nice example from history, which I think a lot of people might be familiar with, but I think it also illustrates the whole process of medicinal chemistry quite well. So here you can see willow bark, which has been used since ancient times for its analgesic effect. With the rise of more modern science, if we get to 1826, we're actually capable of isolating a pure compound and also characterizing the structure. So this led to us discovering salicin. Then moving along the timeline, we're then able to modify this natural product and derive salicylic acid from salicylin in 1838. And then finally, salicylic acid is then further modified with an acetyl group, which is highlighted on the structure. And this is what we all know as aspirin. This was commercialized by Bayer. And that acetyl group is actually really important for both making the drug more tolerable and also improving some of the cardiovascular effects of aspirin. And this is a major blockbuster drug that's commonly taken. I think this example really shows a few key parts in the story of medicinal chemistry. So first, identifying a lead compound, understanding the structure of that compound, and then starting to make different derivatives and seeing how that impacts the biological activity, figuring out what's actually important in the structure. You can see salicylin has this massive structure, but actually aspirin is a lot smaller. So those are some key concepts that I want to kind of show to you through this example. Now, on to antimicrobials. So I quite liked this timeline because it kind of shows you, although it's a bit small, but you can get an idea of just the array of structures that are available and the timeline in which they've been discovered. There was a golden age of discovery from about the 1920s up until the 1950s, where a lot of different molecular classes were discovered and implemented. However, sadly, there has since about the 1950s and 60s been what is sometimes called the discovery void, which sounds quite sad, but there haven't really been that many new classes discovered. And this is actually really important because as soon as drugs are introduced, resistance can also be observed. So this is another timeline which shows when different antibiotic classes were deployed and then resistance beginning to show. So you can see things like vancomycin, resistance being detected, etc. So it's really important that we try and stay ahead of the curve and discover new methods of treatment due to resistance building. Right, so this is a very interdisciplinary audience because we need an interdisciplinary approach to actually deal with antimicrobials. So we've had a few talks today about all the different things you can do in terms of policy and stewardship. And so now I'd like to take a moment to talk about other aspect, which is R&D, which is what this project focuses on in trying to develop a new antimicrobial compound. So I'm in a chemistry research group, and we didn't go out and collect soil samples. What we actually ended up doing was collecting all the random compounds we had made over the years for various projects and sending them over to biologists in a compound collection. We also had some collaborators at the University of York in the Onsworth group who also sent us some of their compounds. And together we were able to submit about 1,500 compounds to our collaborators for testing. And I've shown you summarized on this table the number of different tests which were conducted. The main thing I want to basically say from this table is that you can see that with each successive step, the number of promising compounds is decreasing as we go through looking at their activity essentially against microbial compounds, and also how drug-like they are. Things such as looking at their cytotoxicity. Do they also impact and hurt surrounding cells and things like that? So essentially, after going through a series of different tests, we were able to discover 4 compounds, which we defined as our lead compounds. And the one that I would like to talk to you about today is that top compound, which I've highlighted, which is a polysubstituted indole, which is the main focus of my current project. So this is the lead structure. That core scaffold you can see in the center is called an indole. And there are 3 substituents coming off that structure at the 2, 5, and 7 position. So in our screening, we did a phenotypic screen. So we know it has activity, but we don't know how it's affecting the actual bacteria. We don't know where it's actually impacting it. We have no idea of how the structure is actually involved in that whole process. So one of the first things we wanted to do in this stage is kind of determine the necessity of different substituents and also explore different substrates, because we have actually quite a wide variety of options available because we don't really have a crystal structure or anything. We can actually explore lots of different things and see what works, what doesn't work. The other aim, of course, is to, because we are chemists, is to assess a viable route towards making these compounds. And I explored a few in this generation. Indoles are very annoying to work with. And getting substitutions of the same position is particularly difficult. So also had a bit of a chemistry challenge in just finding a route towards making these compounds. So I started with what seemed the logical step, which is using the method which had been previously used by our collaborators to make this compound. So this is just basically illustrating a series of steps, which chemical synthetic steps, which enable you to get to your final compound. So you can see a number of changes occurring in the structure with each successive step. With each step, though, you lose yield. This is called the arithmetic demon. The more steps you have, the more material you need at the start to basically have a usable amount of your end compound. And although this was a really interesting route with some really interesting chemistry, we just found that there were many issues scaling up this route to get to our final compounds. And there were just many steps involved, which of course added time and difficulty. And particularly these first few steps were creating a real bottleneck in our synthesis. So we then looked at some more classical methods of making indoles. One of the most famous ones is the Fischer-Indole synthesis. You can see it occurs in just one step. You can have an indole. So using this method, I made 8 different indoles, and I've summarized the different substituents I've used basically on the structure there. So, and the main difference here in this series compared to the lead compound shown in the center of the slide is that I've got a hydrogen. I'm not sure if there's a clicker actually out there. So, if you can see at R2, the main difference that in that first sort of band, the main difference between that compound and the lead compound is that there is a hydrogen at that position, so no substituent compared to the alkyl chain in the original. And you can see that's consistent across all the different molecules. What we found in this series is that we had a loss of activity, which is of course sad. You always want to see activity, but this did give us some important information, which is that that 7th position is actually really important for having activity in our compounds. So this has informed our decisions in subsequent generations and basically made us say, okay, how can we get substituents at that 7th position, and what sort of substituents do we want for activity? So since making this series of compounds, I've found 2 modes of making them, and also one of the guys in my group, Tomasz, has also found some other routes. So we are armed with chemical methods for making these drugs now. I just wanted to quickly show you 2 of the routes which I've found, which have actually quite different approaches, and their own benefits and drawbacks. But the one I'm really leaning to at the moment is using palladium catalysis. It starts with a Sonogashira cross-coupling and then a cyclization step to form that indole. You can see I've highlighted 2 points at the 7 and 5 position, because those are the points which I will then further modify to add substituents, either through cross-coupling reactions or transferring that chlorine into methoxy or hydroxy group to basically better mimic our lead compound. I've also got a second step, a second synthesis synthetic route, which is the Madelung indole synthesis, which is more of a backup option. I think it has its own benefits if we're looking at maybe modifying the second route in a different way. But basically, I wanted to show you this to show that there are different ways you can get to a drug and different benefits and drawbacks, which in medicinal chemistry, there's of course making the drug, but also making it in the most efficient way possible to access the greatest variety possible, so you can have a quick understanding of the structure. And that's sort of where the game and art of organic synthesis comes from. The next question, now that we have this route, is, well, what should we put at that substituent? So looking back at the first generation of compounds that were submitted, we can then assess both what has already been made. You don't want to make something that you've already got data for necessarily, and also getting an idea of like, okay, what substituents do at this point. So I've got that indole core structure on the top row, and then a very similar looking structure at the bottom half, which is the carbazole core. You can see it sort of looks like an indole, but it's got that aromatic ring on the side, which I thought looks a little bit like actually the aromatic ring we have the 2 position. So I thought it'd be a relevant structure to look at and see, okay, what have we also got there? What sort of activity have we got? And so at the moment, I think what I'm leaning towards is making a variety of different alkyl substituents, and also in the literature we've seen not that many aromatic substituents at the 7th position. So I thought that would also be quite an interesting addition to make to these compounds. So that is where I am with my actual PhD project. But I've also been trying to take advantage of some of the different opportunities available at Cambridge to look at AMR outside of the lab as well. And that brings me to sort of a side project that I'm doing that I thought I'd discuss with you today too. So I'm currently taking part in the development I-Teams program, which is run at the university, and we're assessing if we could essentially set up a centralized bacteriophage biobank to improve the access to bacteriophages for compassionate use in the UK and hopefully beyond. Essentially, Development I-Teams is a program to give students at the university the opportunity to help with an innovation that's proposed by someone, and that's ours. And this started because bacteriophages actually are natural bacterial predators that exist in nature and can be used to treat bacteria and used as antimicrobial agents. In the UK, they're usually used as a last resort for compassionate use. But in other countries, such as Georgia particularly, they're used quite regularly. And growing interest is, there's actually growing research interest in their use, particularly in the US. And one of the key factors that led actually to our want to actually improve compassionate use is that our proposer, Maria, who actually was a PhD student here, was asked by clinicians in the UK to assess if she could find a bacteriophage in her lab biobank that could help treat someone who had a really severe infection. And she worked really, really hard for like a week to try and identify bacteriophages that could potentially work. But I think that experience just led her to think, okay, there surely must be a better way to do this, a more efficient way that I could help people somehow. And that's why she approached the Development I-Teams program with this idea. So she's really passionate about it and really wants to make this work somehow as a commercial venture. So we're doing primary and secondary market research to assess regulation and see, can this actually work in the UK, and then deploy it in developing countries. is actually, we didn't realize how hard a topic this was, because actually this week, the UK government announced that they were assessing the use of bacteriophages in the UK. So we've got some competition. But I thought I would just, I thought I would plug this and just say to everyone in the room, a few of us are here as well. We're really happy to talk to you about your ideas and your thoughts on this working and how this could be implemented in the UK and also in other countries as well. So with that, I'd like to end my talk with some thank yous. So I'd like to thank my research group, the Spring Group. We can see us here with our Christmas jumpers. Also the photo group at the LMB who do our biological tests, the Unsworth group at the University of York who also supplied compounds for our compound screening, and the Development I-Teams and Centre for Global Equality for running the Development I-Teams program, which we're doing the bacteriophage project with. So thank you all for your time and giving up your Saturday to come along here, and I'm happy to answer any questions that you may have.
Okay, thanks for the next talk. Just a couple of questions like stuff. You showed all the structures, but in terms of actually making them into a drugs, are those structures protected in terms of IP and stuff like that?
We don't think we've found any. So in chemistry, you can basically look up, there's a database where you can look up structures and if they already exist in the literature. And I don't think I found any apart from the ones in the paper that we have. Yeah.
Those were protected before we published.
No. So I think basically we're sort of playing around with these structures as far as we can. There are actually quite a lot of papers out there on Indole. So I think the way it works, well, the way it works in organic chemistry is you can basically make what you want. And explore around things. There are certain structures which are IP protected, but if things are publicly available in the literature, you are okay to develop them further. It's better though to maybe contact the research group to see what they're already doing. And yeah.
And just to follow up on that, you said you tested this on TB, but have you tested it on other sort of escape pathogens and things like that?
I think I don't think we have. I think it's Mycobacteria and just TB. As Tomasz is also working on the project with me, was in the audience.
Because I just want to,
yeah,
like if you're not aware, then there's a group called COAG in Queensland led by Mark Gaskovich. It's Community for Open or Collaboration of Open Antimicrobial
okay, yeah,
which basically takes compounds from groups such as yourselves and tests them on the whole
yeah,
group of pathogens, fungi, bacteria.
Okay, no, that's great to know. Thank you. Yeah.
Yeah, so phage therapy has been around for probably about 100 years. So what has prevented its widespread use?
So there, some of it's historical and some, and then also that leads into regulatory issues. So apparently when essentially the phage therapy is actually used quite a lot in old sort of Eastern Bloc countries. When the Cold War happened, there was a split in terms of thoughts on what treatments were the best. I think most of the West went to antibiotics. More of these went into phage use. So actually there's an institute in Georgia that actually has a clinical biobank set up and it's used pretty widely. They actually even have like over-the-counter phage therapies that you can access. But in terms of the way in which the regulation is set up, it's really set up for small molecule drugs. So it's quite difficult sometimes getting newer therapies to pass those requirements. And with phages as well, because they are in this weird sense that sort of dead and also living and biological things which can change over time, it's really hard to get a standardized sample that you can do tests with. Additionally, they're also often used in combination with antibiotics, and that also adds further complication in how you set up those standard studies to build the body of evidence required for licensing and use in the clinic. So that's why a lot of it's actually used as a last resort for compassionate use. But our hope is that by enabling better compassionate use, we can build a greater body of evidence in this therapy and therefore enable wider use further on. So this is sort of a very early stage first step in trying to build more of that evidence that will enable more use in the UK.
I think we'll leave it.
Yep.
Thank you very much.
Thank you.